Hi everyone, my name is Maria McEnery and I'm a Cancer Prevention Officer at the National Cancer Control Programme, and I am coordinating the implementation of the National Skin Cancer Prevention Plan. So the current plan runs till the end of 2022 and we are currently in the process of writing our new plan for 2023 plus. So I suppose the plan aims to tackle the rising incidence of skin cancer here in Ireland, to increase awareness and engage people in UV protective behaviours such as protecting their skin from the sun and also to not use sunbeds. So currently there is just under 13,000 cases of skin cancer diagnosed each year. And as you can see from the projections on the screen here, both for melanoma and non-melanoma skin cancer, the rates are increasing year on year. So there is a lot of work for us to do in this area. So as part of the skin cancer prevention plan, there are certain at-risk groups that we're specifically targeting, and those are children and young people, outdoor workers, those that pursue outdoor leisure activities, and also sunbed users. So there is different work streams that are progressing with priority groups, but today I'll be focusing on working with the travelling community and I suppose looking at work that we've already undertaken and work that we are planning for the next year. So just to give you some background information, research done in 2018 found that there were significant differences in relation to cancer, skin cancer, and specifically in the use of sunbeds for the travelling community. So there were low levels of awareness of the risks of sunbed use. Also, women linked tan skin with health, beauty, happiness, and believed that sunbeds were good for their health, having a positive effect on conditions such as arthritis and psoriasis. And then for men, use of sunscreen was regarded as a sign of weakness, and tan skin was associated with health and well-being. So I suppose based on research that's been undertaken, we wanted to look at ourselves with the different at-risk groups, how we could progress some work with the travelling community. So the HSE National Cancer Control Programme, in conjunction with Department of Children, Equality, Disability, Integration and Youth, as well as the National Participation Office, undertook a consultation with young people aged between 12 to 18. And this was undertaken last year in 2021. So I suppose the aims were to gain greater knowledge of the attitudes and behaviours in relation to skincare in the sun, also their use of sunbeds, so how often they use them, and how to get promotion of health messages to this population group. So based on the consultation that we held, there was a lot that we learned. So the best person to get health information from is parents or healthcare professionals. The best way to get information to them is through word of mouth, through the radio, through personal stories. So people who have gone through a form of skin cancer. And then I suppose when it came to social media and platforms like Facebook, it was quite mixed. So some people trusted it, some people didn't. A lot of them would look for reliable sources, such as government bodies. The reasons for using sunbeds, there was a wide range of reasons given for why young people would use sunbeds. Many were to tan, to be attractive to the opposite sex, for positive self-image, self-confidence, to feel happy, also preparing for a holiday, so a holiday overseas or abroad. And then I suppose when we looked at reasons for not using sunbeds, that included skin damage, the aging effect, health risks, cost, or not being allowed to use them. So I suppose based on the consultation last year, we then looked ahead for this year for our Sun Smart campaign, and we included radio adverts directed to adults. We also have a skin protection e-learning module, which we have developed for health and social care professionals. And then we included personal patient stories to share on our social media and also through the press. We've also raised awareness of the risks of sunbed use on social media platforms. So specifically platforms that young people would use, such as TikTok, Snapchat, Instagram. And I suppose these were shared throughout the SunSmart campaign, which runs from April right through to September. So they're still ongoing at the moment. We are hoping to do more focused education events with Pave Point directed at young people to, I suppose, raise awareness of the dangers of using sunbeds. And the consultation report is available on our website, but it was also shared with organisations who work closely with the travelling community. And I suppose that's to help inform them of initiatives that they are planning or undertaking. Then I suppose when it comes to sunbed users, we did a project in 2021 with Pave Point. So we developed a leaflet on the dangers of sunbed use, and we also ran a train the trainer format with their health workers in the Fingal and Blanchardstown area. So I suppose what happened is we gave them the training, they then went out to the community, they handed out the leaflet and they informed people of the dangers of using sunbed use. And we got really positive feedback from it, from the travelling community after that education pilot that we ran. When it comes to outdoor leisure, we have provided wide-brimmed hats to children attending summer camps in the northeast inner city of Dublin. We also provided coaches with those hats, and I suppose that is to enforce positive role modelling. We have also provided SunSmart activity manuals, so they are games and activities kids can engage in at the camps, and that teaches them how to protect their skin in a fun way. So I suppose all the projects have been evaluated or will be evaluated as part of the ongoing work that we're doing. And all of our information and resources are available on hse.ie/sunsmart, or you can also contact the email here if you have any questions. Thank you very much.